Hi everyone.
Hello, hello, good morning, good afternoon, good evening
Good
to you all.
afternoon.
Thank you all for joining us this morning. And this morning for me, potentially, later in the day for many of you, I am really excited to welcome you all to this month's Now Next Generation Speaker Series. Most of you are coming from the Campus Ambassador Program, and this is the first month that we are expanding the speaker series out to viewers and audience from the entire Next Generation Network. And for this very first iteration of the Next Generation Speaker Series, I'm very excited to welcome Paul Olale, who is a medical professional, One Health expert, and certified officer in leadership and management and health, project planning and management expert, as well as a research scientist. He is currently the antimicrobial resistance with One Health approach programs officer with the Kenya Red Cross Society, overseeing the project implementation across various administrative localities within the Rift Valley region of Kenya. Important to mention, the project is a regional project that is currently being implemented in 4 countries within the Eastern Africa region, within Kenya, Uganda, Ethiopia, and Tanzania. Currently in Kenya, they're in the second year of the project implementation cycle, and the youth have been and continue to be a vital part of their program. Specifically, his program focuses on enhancing community awareness on the risks and consequences of inappropriate handling of antimicrobials across the One Health space and planetary health space for social behavior change. And with that in mind, thank you, Paul, for joining us this morning, and I will hand the floor over to you.
Thank you, Chantal, and thank you, Tim, for basically finding time to join us this morning. From where I am, it's in the afternoon, so I'll greet all of us. Good morning, good afternoon, good evening, from wherever we are. So I'll basically go straight to the point because of the time allocated. Maybe I need to open my video for those who probably might want to see whoever is speaking. This is, as Chantal has put it, this is Dr. Olale Paul from Kenya. I currently work with one of the organizations within the Red Cross movement, that is Kenya Red Cross, running a project more specifically on antimicrobial resistance. The antimicrobial resistance project is a project that is a regional project. We're basically running it in 4 countries within the Eastern Africa region. And it's actually headed by a consortium dubbed as ROHOKET. In my presentation, we'll be able to go into details around this. So this rocket program actually focuses on 3 major areas. Of course, trying to evidence-based diagnosis, trying to look at how well can our communities be aware of the risks and consequences of misuse of antimicrobials, and also focuses on strengthening healthcare workforce, which is very, very key in just making sure that at the end of the day, we are able to save our societies. Of course, young people are very integral in this, and we're just going to indulge into will enable us see on how well can we be able to involve our young people, and how can we be able to walk this journey and be part and parcel of the most anticipated change around antimicrobial resistance. So Chantal, if you allow me, I can probably share my screen. Thank you. Uh, Kindly advise, is it visible? Is my screen visible?
Yes.
Thank you, thank you. Let me put it on slideshow so that at least the size increases a little bit. Thank you. And now it's quite okay, right?
Yes, it looks great. Thank you.
Okay, thank you. Basically, I chose a topic on one particular area that I'm really interested in. That is antimicrobial resistance. And of course, um, youths, as we all know, are the future of tomorrow, that is globally. And having a youth-led initiative around advocacy in prioritizing global health threats advocacy is actually one thing that I've really been so keen on. So in this context, I'll basically take us through some of the initiatives that we've been able to have, some of the undertakings that we've been able to undertake to have with fellow youths, and how they are basically bringing change within the societies. So as I said, we are basically going to be, I'm going to be a little bit brief, but detailed at the same time, so that we at least as a Planetary Health Alliance ambassadors can find a way by which we can probably be agents of change in our own context. As you all know, is actually a universal problem. It's a global threat, and I'll go straight into the background before we get to the brainstorm questions. If you look at AMR in its entirety, this is basically a war as a pandemic. According to WHO, this is one of the top 10 threats that is actually threatening the existence of human life. Take our attention, and as young people, as I've said, we are the agents of change. We are the future of tomorrow. And of course, if we possibly can be able to pick this up and run with it, basically, we're likely to save a lot in terms of some of the components that we're going to talk about. So I'll go very fast through the background of what AMR is. Of course, AMR is more of uh, the ability actually of some of the common microbes or common pathogens be able to resist the effect of some of the drugs that we commonly use. And in this context, we're talking about antimicrobials because globally. So according to uh, some research that was done in 2019, you realize that we have more than 4.95 million deaths to drug-resistant pathogens, including 1.27 million, which were directly linked to AMR. So if you compare, and I want to give a case scenario, if you compare this number of deaths that are attributed directly to AMR in 2019, and then compare with the COVID pandemic worldwide, and then look at it in the lens that how COVID really terrified the world and how people were almost running short of most of these particular health services components and all that. If you look at the numbers, these numbers are way high. And simply because it's silently hitting us, nobody really is giving it the interest it deserves. And that's the reason why, in my thoughts, within our project, we've been really working with young people who have really created a significant change, as we're going to demonstrate here. So this is just about a background. Of course, of interest is the One Health, which now augurs very well with one of the objectives of the Planetary Health Alliance, the One Health approach that this needs to take in order to at least be part and parcel of the solution. So, of course, it is actually recommended, or it's actually said that this requires a complex and, of course, a multi-sectoral kind of approach for us to be able to win the war. I won't dwell so much on the background. It's important also to note this particular segment. It is important to note that The reason as to why AMR is of global concern is because every now and again we are having new resistance. The pathogens are actually developing new resistance mechanisms. Okay, there are lots of emerging illnesses that are actually caused by the pathogens that we know of, but basically they have since undergone certain evolutions that we'll need to go out there and ensure that our people or our communities actually have the right information so that we're able to tame this. And then, of course, one of the reasons as to why also we need to worry about this and we need to take action now as young people is because of the likelihood of high risk of medical procedures that's likely to come with procedures such as organ transplantations or even major surgeries such as C-sections or even hip replacement. This is something that I'm going to expound further as we're going along so that we at least get the urgency of why really we should form part of this movement of this change under the PHA. Right. So I've just mentioned about the kind of impact that uncontrolled MR could actually have in our food and livelihood segment. Of course, there is a high certainty that if nothing is done at all, then we are likely also to not to achieve by 2030 our SDG or Sustainable Development Goal 2 that speaks about food security. Then we also are likely to face some of a reduction, or we are likely to lose a lot in terms of the gains that we had been able to achieve health-wise as per the MDGs. And of course, that then will enable us or will not enable us be able to at least get to where we want to be in terms of SDGs. We also have the aspect of food security, which is also threatened by this. And I know we're going to understand this with respect to what I'm going to mention in the next slides. So why there is need for urgent action on AMR? Why do we basically need to act now? And as I said during when I was actually giving that particular background, if you look at the demographics worldwide, young people are like now becoming the backbone of this particular our economic chain. And within the innovation space, it's the young people who are domineering. And therefore, it is believed that with the involvement of young people as ambassadors and as champions in this particular area, we're likely to achieve a lot globally. So why is there urgent action? It is estimated that up to about 700 deaths globally a year are as a result of drug-resistant diseases. One of them being multi-drug resistance, TB. We also have an approximation of up to 10 million deaths that are approximated globally per year by 2050 if no action is taken. Of course, this is as per one of the reviews done by O'Neill, who is a very prominent researcher back in 2014. So that then calls for some bit of investment in this, and we are the right people as the youth to be able to get into this space. Now, allow me get into some just a show of how the projections look like so that we get the urgency of why we really needed in this space. We have about by 2050, we in comparison to other causes of death, as of 2019, if you look at this particular graph, this particular figure, you then realize that as of 2019, we were talking about 700 deaths. That's a low estimation. And as of 2050, we'll be talking of a tune of 10 million annually, which then will mean that other diseases that are really threatening our existence and we're really aware of because they are conspicuously talked about, such as cholera, diabetes, cancer, other major disasters such as road traffic accidents, measles, will probably be way below what we are likely to be facing with AMR, and therefore our involvement will really be very key. I just want to take us very fast through major drivers so that we get into the context, and then thereafter we'll get into how can we as the youth be involved, and then look at how have some of the youths that we've been able to involve or that we've been able to work with really have done it within their settings. So some of the major drivers that are of essence for us as ambassadors and are likely to be of keen interest for us, we have one, environmental influences, right? These are common things that we interact with from time to time. These are things that we basically do, or either knowingly or unknowingly, will then probably be causing harm without really being conscious about them. So if you look at some of the environmental influences or factors that are actually leading to AMR or are actually classified as major drivers of AMR, we have aspects of river, soil, and air contamination, basically environmental contamination. And some of the practices that our communities are fond of are basically, and has become a norm, the release of untreated wastewaters with significant residues of antimicrobials has actually become a norm in most of our societies. Yeah, without really getting to know how this is likely to get back to our food chain, for example. And then we also have issues to do with compromised sanitation and hygiene. You know, we have many parts of the world where we are ailing from that actually cannot be able to access clean water up to this particular point in time. And therefore, these are some of the components that have worsened the spread of infectious diseases and thus raising the demand of antimicrobials. And you know, the more we utilize them, the more the likelihood that resistance is likely to evolve with respect to these particular pathogens of target. And then we also have another second component, another major a driver, which is basically misuse and overuse of antimicrobials. And of course, I'll sum this up with a question later on. If you look at this, you'll realize that more or less all of us have been into this space where you either go to the hospital, you're given a full course of drug, and then you end up doing a 3 days course, and then simply because you've probably felt well, you then discard the rest. And that has been a common thing, you know, with some of us. Others will basically utilize human drugs on animals, right? And, you know, without consciously knowing the kind of harm that we're likely to cause to ourselves in the long run. Of course, the resultant aspect is having various pathogens getting resistant to such drugs, which probably initially they were susceptible. Then we have also aspects to do with the use of growth promotion components, which are majorly antimicrobials on plants and even animals. You know, excessive use of this particular growth promoters has also an impact in terms of residues retention in some of these particular components, in these particular plants and animals. And at the end of the day, these residues get their way into our bodies. At the end of the day, of course, they tend to interact with a number of pathogens that they ought to be dealing with. And at the end of the day, these pathogens tend to get away of actually gaining resistance in the process, or evolving to gain resistance. Another aspect that is very key, which is a very key driver, of course, we have the healthcare factors. Amongst the healthcare factors that are very key for us, of course, we have so many parts of the world that are facing inadequate infection control simply because of probably a knowledge deficit or maybe compromised facilities around infection control. And that is not basically because they wish to, but because of the situation that sometimes they find themselves in. And then we have, of course, lower AMR awareness. I am certain that amongst ourselves who are among the privileged young people within the education domain or within the academic domain, you'll realize that if we were to ask here, out of all of us, how many are actually fully aware of the real consequences and the risk of AMR, you'll realize that majority of us as well, we've not really paid attention to what are the real consequences of AMR. Of course, we on daily basis probably interact with people who are facing these particular challenges and consequences of AMR or of actually misuse and overuse of antimicrobials, but rather we cannot be able to react simply because we've not been able to pay a keen interest on it. But I believe at the end of the day, from this particular engagement, we'll then have a different thought that is really going to help us be ambassadors of change. And then, of course, we have weak and inadequate surveillance systems across globally. Of course, especially in low-income countries, you realize that the rate of detection of AMR, basically by just looking, for example, at a situation that might probably be depicting some resistance. For example, one suffers, let's say, gets to the hospital and is diagnosed of pneumonitis. This individual is given the routine medication. 2 weeks later, he or she is still not well. Then this individual is then taken back to the hospital, takes about 2 weeks in the hospital on admission. He gets out of the hospital feeling a little bit better. After 1 month, they get back to the hospital. Such happens. Of course, that is a clear indication of some bit of resistance or actually of antimicrobial resistance. But rather, at that context or in that context, in that framework, we little tend to relate that is likely to, yeah. So it's something that I know after this will also probably help us. That know-how will really help us in just making sure that we are agents of change in that context. And then lastly, one of the major categorization that I just did with respect to major drivers of AMR, we have the socioeconomic aspects. Of course, poverty. We have many parts of the country where people are living below their gross domestic packages, and this is something that really is of interest. And of course, as ambassadors and as figures of change, we can basically get to a point of knowing how to approach such settings, knowing how, despite the low income levels, but still we can be agents of change by just getting them, making them know on what are the clear procedures that they can be able to follow, just but to make sure that they are a little safe, like just getting to ensure that they promote or basically adhere to the routine hygiene conditions, such as just simple hand washing and so on and so forth. That can save us a lot in just making sure that we don't fall into this particular AMR trap. Then we also have compromised governance is also another social factor. Of course, we have weak regulatory systems in some of our countries and enforcement breaches that are likely to also compromise how drugs are dispensed, how pharmaceutical productions are done, and all that. Of course, ours will not be to try and fight these particular systems, but rather start from the base, where we get into the community, try and sensitize the community so they be part and parcel. They don't be part and parcel of the problem. For example, from where I come from, you realize that there's a common habit of people self-prescribing. Where if you fall sick, probably, let's say, you have some flu, yeah, people will tend to run to the nearby pharmaceutical outlets to just ask for antimicrobials without getting to a facility for purposes of getting proper diagnosis. And that has become a norm. And the reason as to why that is still being propagated is simply because we have good policies, but these policies are not adhered to, or either they are being adhered to, but people have devised ways of actually evading these particular systems. So since we are the people in the community, and this is something that we can really capitalize on, we now get back and start doing it retrogressively rather than doing it through the normal channel of going through the regulatory systems. We rather now start from us, from the community. Let's enlighten them and ensure that they don't be part and parcel of this particular mess. That is all about just but the major drivers. This is just but an illustration of how antibiotic resistance spreads. Of course, you will see from the image how we have different players, all the One Health players. We have antibiotics given through food to animals. The animals tend to consume them here. Yeah, they tend to develop in the process, they develop drug-resistant bacteria in their gut, and then once that is done, of course, we'll consume the meat or maybe consume some of the products such as milk. At the end of the day, the drug-resistant bacteria reaches humans through the food that we consume. So directly, we'll probably have the drug-resistant bacteria, which then now is in humans and can now be spread to other humans within the general public. Now, we also have this other way where antibiotics are given to patients, and then as a result, drug-resistant bacteria develop within the GI, and then as a result, patients attend hospitals and clinics. And of course, we have drug-resistant bacteria spreading to other patients through nosocomial ways within those particular poor hygiene settings within the facilities or some of the facilities that we tend to attend. So if you look at this illustration, you'll then realize that you might probably be adhering to all the aspects as an individual, or you might probably be an agent of change, and you really adhering to some of these particular teachings or adhering to the concepts. But in the long run, you probably are going to get it if you don't approach it wholesomely, or if we don't be our brother's keepers, which we can do very well through our innovative digital presence. You are likely to even get it in a hotel that you're going to sit in. You are likely to get it in a cafeteria where you're going to have your tea. You're likely to get it even in your neighborhood where you're probably going to have some milk or some fruits or some, in Kenya, we talk of nyama choma, without knowing. So this is the reason as to why, as much as it is going to all start with us, we also need to be in a space where we are going to be our brother's keepers, and we are going to be ambassadors of just making sure that awareness is spread as much as possible. And I'll emphasize on that shortly. The most important section for us, that was more of a background of one of the topics that I chose for this particular session. But key for us is where now we've gotten to, where now we need to ask ourselves, why the youth? Why the youth? From the background I got and from the expansive initiatives that PHCA has actually been able to come with, and just looking at the alliance and the vibrant case of ambassadors all over the globe and within the East African context, as per se, you'll then realize that we really are sitting in a potential that when ignited, then we can really bring a lot of change countrywide. So why the youths? And I clearly chose this for simply because I know we have the ability and all these things are actually in our hands. So we possess digital innovative skills. and you can always testify. And I know, Chantal, we see what happens around the TikTok spaces, the social media. We see what happens in the LinkedIn, of course, is more of professional, but whatever happens within the Facebook platforms, Skype, um, TikTok, and all that, really, you can clearly be able to testify about the real skills that our people have, or whatever the skills, innovative skills that this young generation have. So basically, how well can we be able to tap these skills and turn them into the development of content that are specific to trying to help the community? That's the main goal. The number two, of course, why the youth? Is because we are the future and present community change makers. We, through the skills that we have, merged with our demographics, backed up by our demographics, of course, youths are making up of close to 50% of the global population. That alone then tells you that, then if youths are involved, then the likelihood of us realizing change much more faster than when they are silenced is very high. Then we also have the aspect of us being the future advocates, policy implementers, and advisors on One Health. Whatever we see the generation before us doing today is exactly what. So that then tells us that this being an area, or AMR being one of the components that is really becoming a threat to the global health, then it's something that we really need to get into and be so that we have a stable future in terms of just making sure its containment is well thought. And then lastly, of course, with the future global health security agenda stewards. Because this is all about stewardship across the entire One Health, not only on AMR, but of course, our health comes first. And, without health, we can actually not exist. And there's a common phrase of health without wealth without health is equals to nothing. And therefore, we might probably be privileged to have whatever we have, but without proper health, we likely not to live comfortably. And that's what we, backed by our demographics, can actually really be. And then, of course, the goal, I've explained on this already. The goal is basically to empower young leaders. We shall be advocates for One Health approach in deriving solutions within the planetary health spectrum. And that's the reason why I'd say it's not only about AMR, but rather looking at other global health threats as well. We have cancers today, but much talks around cancer have been restricted to clinical settings. We are forgetting about the community that are supposed to be taught on how to lead a healthy living. We are forgetting about the community that needs to be taught about some of the common drivers of cancer. We forgetting about mental health that has become a real thorn in the flesh of so many. So basically, or overally, this session is, as much as it's more of inclined towards AMR, but it's to give us an opening that we as the youth, we have the potential to be ambassadors of change within our own settings. That's actually the primary goal. And of course, I believe we're really going to get the concept right. Now, the youth as One Health stewards. Okay. Yeah, so now the youth as One Health stewards. So if you look at we as the youth, what can we be able to do in this particular space? Of course, we can only do justice to this particular problem or this particular challenge by being ambassadors of change, okay? Being part of, and in the context of AMR, of course, by being part of the community AMR champions. So how can we be part and parcel of the One Health stewardship, or how can we be ambassadors of change within the context of AMR? So one, of course, as I'd said, I'd mentioned this a little bit earlier, development of creative and innovative contents for extensive community sensitization across the social media platforms. Just by getting somewhere and creating a video around maybe the consequences I'm going to show you here with those whom some of which we've been able to create through our interaction with the youth, you'll realize that just a 2 minutes skit or a 2 minutes video of sensitizing people or showing how consequential AMR can be, can change a lot. And of course, you know, the primary goal is to just make sure that we are able to initiate or social behavior change extensively. So of course, apart from development of creative content, we also have the use of creative arts, you know. Within the college settings, you realize that we can easily be able to create skits that can then be presented in community forums, or we can even utilize for peer-to-peer education, you know. And this can really go a long way because some of these things are much more remembered, are easy to remember as compared to the actual readings and all that. And then we have peer-to-peer education. Of course, we can be agents of change through peer-to-peer education. We can have clubs, just like now we are in alliance here. We can then just say that we want to have different topical areas that will be leading and getting us results. We make our own scorecards around different topical area for purposes of just making sure that we are being part and parcel of the change within the community. Now, still on the youth as One Health stewards, of course, the aim is to reduce morbidity and mortality burden globally. That's why our numbers as the youth, is actually really making us get into this space. And again, the innovation around the innovative skills and innovation around all that we do is bringing us to this particular space. So the aim, of course, as I've said, is to reduce morbidity and mortality burden globally. Of course, there are two major approaches. We have the coordinated approach where we have to come together just as the way we've come together here through the Planetary Health Allowance, through the Planetary Health Alliance. And of course, to just have different professionals from with different professional backgrounds getting here to be able to at least be with their experience and with this particular information, get to coordinate the two and be able to be ambassadors of change in their own way within where they are ailing from. And also we have the other approach where we have the people-centered approach. Now, the people-centered approach, of course, majorly focuses on the community members coming together or finding means via which we can be able to get from the community more than we give it to them, you know. Get to the community, realize what the problem is, or do your survey on what the extent of this particular challenge might be, and then let the solution be more of from within. Let them get us the solution. Of course, we give them scenarios and then let them get us solution. For example, you can basically decide today or after this particular session to go back to the community and then let's just try, not even to the community, back to your own family, and then just try scrutinize on how diseases have always been dealt with within that particular family. For example, if you probably had someone in hospital, may God forbid, how will you relate his treatment costs or her treatment costs until they probably got well? You can then pick that and tie it with what we've just talked about, and then check were there components of resistance at some point, or just check back to the family or even within your locality. Are there people who are constantly in hospital trying to fight a condition that probably is not even clear to them? or there are people, a common one is salmonellosis, typhoid, something that if not properly dealt with, is likely to recur so many times simply because it easily most of the drugs that we currently utilizing, especially in the Eastern Africa region, have actually the Salmonella typhi has gained a lot of resistance against it. And you can do that basic study, and then at the end of the day, just relate with what we've just talked about, and then you'll find yourself getting the urge to be able to be part and parcel of just getting away of informing people on how to use drugs appropriately. So, in the context of AMR, of course, how can we be able to enhance community awareness on the consequences and risk of inappropriate handling of antimicrobials for social behavior change? Of course, as the youths, ours basically will be to create skits, just be innovative enough, create a play that can send a message to the that can basically send a message to the community, because we understand our context. We can localize as much as possible, as I'm going to show you in some of the demonstrations that we've been able to have, to be able to just make sure that our people understand what really is ailing them and how they can be able to come out of the problem. And then we have dramas, we have poems, we have short, brief media scripts that we can be able to do and a display or be able to share through the social medias worldwide. We can even develop educational IC materials and post within the social platforms. And an example of IC materials, probably just getting a poster with information around kick AMR out of maybe your locality. That's innovation on its own. And then under that, you just say something to do with, AMR kills. And then thereafter you tell them, do you know sharing of drugs that are prescribed solely for you is dangerous? And then you explain some few points. Those are innovative ideas, and they'll go a long way in just making sure that we are on point. Now, because of time, you'll allow me to just walk us through some of the initiatives that are currently being carried out by the youth in our involvement within the program that we're currently running. So the youth as One Health stewards in this context, of course, if you look at the first picture, um, these are youth actually in one of the centers educating people or trying to create awareness amongst locals in one particular setting. And this is how far the youth can actually be able to go. On this other end, this is an engagement with Students One Health Club. Basically, students who have devoted themselves to be able to create contents that will then be able to inform very significant changes within the community. And this has really paid off based on the statistics that we are currently getting. And I know this is some of the, going forward is a discussion that we can even carry forward and do something about it. That is that. And then this is still one, sorry, I'll just play that. This is still in a continuation of that. These are youths that have devoted themselves to actually get to the community. They do house to house. They do targeted community sensitizations across different areas in Kenya, basically within the North Rift region and a part of the Central Rift that is in Kajiado and Eldoret, or in Uasin Gishu. I know Chantal might be aware of some of these particular areas she's been around. So these are youths that have just devoted themselves to be able to ensure that every member of the community has, or he or she has, information around how well can we be able to combat this particular menace called AMR. So these are really young people of our age that are actually creating a change within the community. You'll allow me, although I'll translate this because partly is in Swahili, just but to demonstrate how the youth are actually getting involved in this particular context. So if you look at this, this is more of a play. For those who understand Swahili, you realize that this particular youth are doing a skit around how people get to misuse. Let me just pause it so that I explain it first. So in this skit, you realize that these are youths that are trying to portray or a household setting. And now these are people who have farms. They are farmers originally. They do poultry farming. They also do vegetable farming. So at the end of the day, you realize that the skit now brings about how people tend to misuse or how people tend to get into the trap of AMR without really knowing. For example, you spray your vegetables today, and once you've sprayed your vegetables, of course, there are specific withdrawal periods that need to be adhered to. But most often in our community settings, we rarely adhere to that, and you'll hear them say, simply because it rained yesterday and you just sprayed, simply because if it has rained today and I sprayed my vegetables yesterday, then there is no harm. The rains have already washed away the drugs and the antimicrobials, and therefore there is no harm. That is one trap that most people have fallen into, and that has really put people into this particular risk of AMR. And then you'll also hear them talk about what most oftenly our communities do around chicken rearing. For example, you're a poultry farmer, you get into your farm and then realize that 10 of your chicken have died. What then happens? The first thing, instead of thinking about the health consequences of your dead chickens, you will then first think about the kind of loss you're likely to go. And so the first thing that most of the people will think of is to go and slaughter the chicken. Probably what has had led to the death of this particular chicken is maybe an outbreak that you could not be able to curb as a result of misuse of antimicrobials on the chicken, and so on and so forth. So that's basically a creative art, which resonated very well with the target audience, and it's something that this is a clip that is currently utilized across this particular region to be able to sensitize community members on what really needs to be done right. So you just see it. Sorry. Yeah, so as I've said, this is more of demonstrating a family setting where chicken have died, but they're not ready to let go the chicken who had died. This is as a result of course, antimicrobial uh, poisoning. They had input lots of antimicrobials in the chicken feed, and at some point, this has really affected the chicken. So the chicken have died, and they're not ready to actually do away with them. So at the end of the day, you realize that they have made a decision to sell some of them, bringing even much more problem to others who are actually outside the family. They have also decided to actually just make sure that they earn out of it without the knowledge of without the knowledge of those they are selling to. So that's those are some of the practices that they were able to bring out clearly through that act that is very common in the community, but people tend to pay very little attention on. But at the end of the day, you realize that the most affected are actually the entire population. Okay, the entire population is going to be affected by a mistake that will actually be rectified by just that sensitizing these individuals and making them aware of the fact that when such an incident happens, then the best thing is basically to discard rather than actually passing that across. Now, the second one, yeah, let's listen to this. Nafaa uoshe mkono na sabuni na maji inayotiririka. Nasema je, Mr. Kibet? Nafaa kuosha mkono na maji inayotiririka na sabuni. Correct. Yeah, so this second clip basically just highlighting what the youths are actually up to. It's not about rocket science or very complex things that they need to do. It's just about all about in the first point trying to prevent this altogether. So these are just but some of the youths that are dedicated to be able to bring change, and they are really bring lots of change within these particular areas that I've mentioned. And I believe as campus ambassadors, we can as well emulate this within our own settings and be able to be agents of change. Lastly, just but sorry. Um, sorry. Yeah, this is one of the plays that was actually basically this is a little bit constricted, but of course I'll be able to share these videos with Chantal so that we are also able to look at really what are some of the uh, ways we can be innovative enough to as ambassadors to be able to take or cascade this particular information down. So this is just but one of the challenges that we've been able to have with the youths. They were doing a challenge, of course, each of them carrying a placard. Of course, this is in a message or in a manner that resonates with the peers or people who are in that particular category. This resonates very well with the youths in school. This resonates very well with those who are in that particular age group in such a way that they'll with that information, they tend to pay attention much more into what is carried and whatever song that is being played to an extent that now this makes them get interested and, of course, communicating an information at the same time. And then we also have the second one, which basically a demonstration of what happens within the community. This is one of what happened regularly. They just picked of a scenario that tends to happen within the community as a result of self-medication. And, this is utilized to actually inform the communities on why you really need not to do self-medication. Of course, I've just have a cut of them. A continuation of this shows how community problems come about and how basically if they go to the right they go through the right channel of getting to the hospital, they tend to get help more than they probably would imagine. And of course, this summarizes this other one. Yeah, so this last clip, basically, I'll be able to transcribe and translate so that we are able to understand the content. This is more of a group of youth that a youth category that has actually come up with messaging that orients very well with the community members on how you should actually carry out yourself in terms of how you handle human antibiotics or human antimicrobials, um, as well as animals antimicrobials, as well as plants antimicrobials, and that's what basically it is. Lastly, of course, addressing MR is a shared responsibility, and that's the reason why, as the Planetary Health Alliance, this is a very key component that we really need to embrace, not only in the context of AMR, but rather in the context of global health threats that I just mentioned earlier on. And I believe through this particular forum, we can be able to reflect, think about this, and also see a way forward on how we can probably be ambassadors of change. Of course, coming together as a team, doing it as wholesomely as a team is really likely to give us or bear us more fruits than we really expect. So that then brings us to the end of the long presentation from my end. Probably I'll take it back to Chantal for questions and for any reactions, maybe if there is any. Back to you, Chantal.
Yes, thank you so much, Paul. That was a very, very interesting presentation. I think it applies to a lot of work we're trying to do with the Planetary Health Alliance, and also a large part of the global planetary health community is focused on One Health and bringing animals and other livestock and wildlife into the picture in terms of environmental change and human health. So this is very applicable for our community. I do want to ask if anyone, I know we're coming up on the end of the hour, so I want to be mindful of everyone's time, but if we have any questions, I think we have time for one or two quick discussions.
I have a question.
Yes, go ahead, Livia.
Oh no, my internet is acting up. Can you hear me?
Yes.
Okay, so thank you so much, Paul, Dr. Paul, for that insight, those great insights. But I have, I don't know if there are suggestions, but I'm also passionate about, okay, my name is Livia Nyakundi. I'm a fifth year medical student in Nakuru at Egerton University. I also work with the One Health Club in my school, and just maybe what other planetary health ambassadors can do, observing the specific days set aside to celebrate, maybe say One Health, the one that is usually in November, and we can. Sorry, I saw Celine's Makale's text and I got confused. But I'm saying to encourage the young people also to celebrate or mark these important days, such as the One Health Day, which is usually on November 3rd. Like I remember last year during our project, we focused on hand washing techniques in various schools to teach the young people on hand hygiene, because as we all know, these bacteria are also transmitted like through contact. And like when we hand wash, we can also reduce some of these rates of infection. Again, I have a question. There's this youth task force that was formed in Kenya. I don't know if it's only in Kenya, antimicrobial resistance youth task force, but I feel like it also should be inclusive. You just find it's from only maybe the one side or one part of the continent, and therefore it's not all inclusive. And therefore, working alone, as you have said, can get challenging. So maybe also those who are in charge of these selections and like co-creation of such task force can involve like most of the people or most of the youths. I also feel like the integration of like antimicrobial resistance or any training on planetary health is also key. So maybe if you sit on those boards, or rather if you sit in those teams that tend to make policies, like you can also suggest to them that they have at least a few youth representatives attending these forums, that because the young people also have ideas. And then like I think sometime in March there was a shared contest on One Health by the International Student Association of One Health Alliance. And also like there can be more of such competitions and abstract, whereby even the young people can like share or submit their ideas or the projects or rather research that they have been undertaking. Thank you so much.
And I know since we are running short on time, Paul, if you don't mind answering that, and then also Hemsline's question in the chat as well about getting involved, that would be great.
Yeah, I think that is in that is in order, Chantal. Yeah, good, very good suggestions from Olivia, who is also joining, very soon joining the space. It's something that is doable. It's something that through the alliance, I think we can be able to find a way out on how well can we be routinely on to our ambassadors so that they are able to as well be able to carry on with the good work that they basically started last year. It's so really important that honoring these World Days is very key. And of course, it's one of the platforms that as PHA, we can easily be able to go worldwide. We can easily be able to get the recognition that we really want at the same time, changing lives or initiating social behavior change. So it's something that I'll be very much willing because of time. I know we'll continue interacting, and I know through your guidance, Chantal, we'll be able to see on how to further cascade this information to our ambassadors so that at least we are able to touch on each and every individual.
Thank you for
And
that.
then yeah,
Sorry, go ahead.
Yeah, on the questions on the chat, probably if you can mask them, and then probably because we are in one platform, we'll be easily, because of time, maybe we'll be able to answer them, and then push some to maybe our offline engagements as well. Over.
Yes, it looks like the only question in the chat currently is about getting involved, and then Livia had a comment about honoring the days set aside, such as One Health Day, hand washing, and hygiene days. And I think yes, honoring those is fantastic and always, in the terms of the larger Planetary Health Alliance, we're not always aware of all of the different days and events that are happening within our different spaces, including the One Health space. So please, Paul, if you have any that you'd like us to share, Livia, anyone as they come about and you're aware of them, please share them with us, and we're happy to kind of post them as events, on our website, share them with our socials and things like that. But I think I'm not seeing any other questions at this time, and I know that it is a minute past the hour now. So thank you all for joining with us today. Thank you, Paul, again for attending. This was a great presentation to have again as we first start opening up the speaker series to all of our next generation audience. So I hope you all have a great rest of your day, a great rest of your week, and I look forward to staying engaged with all of you.
Yeah.
Thank you.
Thank you, and bye-bye. Thank you. Thank you. I appreciate it.
Thank you. Bye.